Good afternoon, and thank you for joining us for the last webinar of our special Nevada Immunization Learning Exchange series, Super NILE Flu Edition. This is Brianne Van Dyne, Education Manager for Immunize Nevada, and I will be today's moderator. The flu-focused theme of this week's NILE webinars was purposeful. With the convergence of flu with COVID-19 fast approaching, communicating the importance of influenza vaccination is more important now than ever. Immunize Nevada is excited to be a part of efforts to promote influenza vaccine coverage rates in our state and beyond for the 2021 season. Before we get started, I'd like to review a couple of housekeeping items. First, if we should become disconnected for any reason, please log in again and we will continue. Second, please locate the Q&A box at the bottom of your screen. If you have any questions, type them there and we will address those at the end of today's presentation. Additionally, if you have requested continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar has ended or in the follow-up post-webinar email that will go out tomorrow. All continuing education certificates will be emailed out within the next week. Please note this webinar is being recorded. The archived presentation and slides will be available on immunizenevada.org/webinars within the week. Before we begin, I'd like to provide a little disclaimer. Immunize Nevada's NILE webinars are made possible by the generosity of speakers who donate their time and expertise to benefit the coalition. The expectation and goal is for community partners to gain knowledge on immunization and infectious disease-related topics through a non-branded, unbiased presentation. And with that, I'd like to officially begin today's featured presentation, The Critical Importance of Flu Prevention, Insights from a Mother Whose Daughter Almost Didn't Survive. It's my pleasure to introduce today's presenter, Shelley Allen, President of Families Fighting Flu. Families Fighting Flu is a national nonprofit 501c3 organization dedicated to saving lives and reducing hospitalizations by protecting children, families, and communities against influenza through education and advocacy. Shelley originally came to Families Fighting Flu in 2013 following her daughter's near-death experience with flu. Shelley has served on the board of directors for the organization since 2017. Welcome, Shelley.
Thank you, Brianne. I first want to just say thank you to Brianne and Immunize Nevada for having me today. This is truly, what I do now is go around and, or when asked, tell Maddie's story. So I'll start with Maddie's story and then I'll in with some more information regarding Families Fighting Flu. And then if there's any questions, please feel free to ask me. So as you can see on the presentation, this is a picture of my daughter, well, several pictures of my daughter, Maddie. Back in February of 2011, she came home from school not feeling the greatest. Had a cough, but she had a birthday party to go to that night and she really wanted to go to it. So I, said that was fine, she could go. And then about 2 hours after she arrived at the party, she called me and said, I really think I need to come home. I'm just not feeling well. So I went and got her, and that night, that was a Friday evening, and that night I could, she was running a fever, so I just gave her the over-the-counter medication, Tylenol, switching out with Motrin and stuff. And then Saturday, she woke up and she seemed to be doing better. So she had the cough still, but it was like the fever had sort of broke. And so, we went about our Saturday. Then Sunday, she became not, ill again, not feeling well. Like her back started hurting. She became very uncomfortable, just couldn't get situated. She ended up, at 12 years old, she was just as tall as I was, but she was like, the only place she could get comfortable was like pretty much laying in my lap like a baby. And so we knew that there was something going on, but we just wanted to wait until the next morning, which the pediatrician's office would open at 8 o'clock that morning. Throughout the night, she didn't sleep real well. Probably about 7 o'clock, I said, well, why don't you go ahead and we'll just take get you in the shower. Maybe that'll make you feel better. And then the doctor's office will be open and we'll get you in. Well, she asked me if I could help her get in the shower, which, I was like, okay, not a problem. I will help you. And I remember closing the curtain and just stepping out to get a towel for her. And when I opened the curtain, I was in complete shock. Her skin had went really pale, like almost a grayish color. Her eyes were sunken in and her lips were turning blue. So at that point, I knew something was going on, but I didn't want to panic, because if I panic, it's going to make her panic. And so I got her out of the bathroom and sat her on her bed. And I remember calling my husband, who had just ran to the store to get, some things for the day and stuff. And I remember calling him saying, you need to get home now. We've got to take her to the hospital. And he's like, I'm in the checkout. And I remember, screaming on the phone, sort of, just leave everything, just come home and get us so we can go straight to the hospital. We walked into our local hospital about 7:30 that morning. She was able to walk in the hospital. I had to sort of help her. She sort of leaned on me, but she was able to walk. She was able to talk. The triage nurse took, vitals and everything and got her right back into a room, and they automatically put her on oxygen. At that point, we hadn't really been told anything. They just said, we'd like to go ahead and do a chest x-ray and blood work and go from there. Probably 30 minutes later, 40 minutes later, they came back in. She was still on oxygen. They had done a breathing treatment. She was still very alert, talking to us. Color was still really pale, grayish color. And they came back and said she had double pneumonia. So at that point, they said, we need to go ahead and admit you here or transfer you to Springfield. And Springfield is about 30 miles from us, Springfield, Illinois, and they have a little bit bigger hospital than what we had. So we went ahead and transferred her. I remember the ambulance driver saying, take your time, don't rush getting over there. My husband rode in the ambulance with her because, at that point she had pneumonia. So I thought, okay, we're going to stay in the hospital for a few days and then we would come home. So I went home, packed our bag for her and I. By the time I got to the hospital, or by the time they got to the hospital, she was in respiratory distress. And I remember before my husband left the hospital with her, I said, don't leave her. She's never been in the hospital before. I mean, she was a healthy, active 12-year-old. She had no other health issues or anything like that. So when I got to the hospital, they took me upstairs and they took me into the waiting room. And I remember automatically being so furious, mad at my husband because he was sitting in there. And I started to say something, and my mother, who worked in Springfield, met them at the hospital. And I started to say something to my husband saying, why did you leave her? When he looked at me and I could tell he had been crying. And I was taken back by that. And the doctor came in and my mom introduced me to the doctor, and the doctor said, your daughter's in respiratory distress. We have her on CPAP. However, her breathing is still just very rapid and it's not good. And so they said, we would like to intubate her. So my husband and I, of course, gave them permission to go ahead and intubate. I remember walking in to her room and, sitting there and talking with her, and she was just begging me to get the CPAP off because it was just so hard for her to breathe with it on. And I kept telling her that, she had to calm down so that, they could get everything worked out. I mean, I didn't know what to tell her. I mean, we'd never been in this type of situation health-wise. And so I told her, that they wanted, put her to sleep so that they could give her some strong antibiotics. I mean, she's 12, so I had to break it down. I didn't even understand myself, let alone a 12-year-old. So I remember, tears started coming down my face because she was crying and I was crying. And so finally they said, we need you to step out of the room so we can go ahead and proceed. And I remember walking towards the door and I heard a faint voice and I turned around and it was Madison. And she just put her hands in a heart shape. And that was the last time I spoke or saw my daughter's eyes for almost a total of 5 weeks. After she was intubated, things quickly declined. Her lungs were pretty much, shutting down. Her kidneys were shutting down. They had to change her over from the regular ventilator to an oscillator, and just things kept going down. I mean, more IVs were being put in. By 8 o'clock, so we got to Springfield at around, I think they got there around 11:30, 12 o'clock. And by 8 o'clock that night, the doctor came and got my husband and I. And by this time, I have a very big family. So the whole waiting room was full of family and friends and stuff. And the doctor came and got us and took us to a separate room. And it was probably the first time I'd heard like the worst words ever was, "We've done everything we can for your child here at this hospital. There's nothing else we can do." And of course, as a mom, I just couldn't understand that. And I just kept saying, "What do you mean you can't do anything more for her?" And so they explained to us that she needed to be placed on ECMO. And of course, they had to explain what it all was for us because I did not know what ECMO was. They said that, just her organs were just failing and nothing was working. So they called in Children's Hospital, which is about two hours away from us. And the flight team got in to Springfield about midnight, and it took them 3 hours to get her transferred from Springfield's bed to their bed to fly her to St. Louis. She was on 14 drips at that time. The flight team said the max that they've ever been able to transfer were 12. So as they were trying to get her moved, her heart was causing problems and starting to fail and stuff. And at this point, we still did not have a diagnosis. All we had was that she had double pneumonia. So as a mom, that was confusing. Like, how can pneumonia just, shut down the organs and everything? And she was young. I mean, I've heard of older people, getting pneumonia and dying from it, but she was young and she was active and she was a child. And so finally, they were able to get her transferred to the St. Louis's bed, and they flew her. It was a 35-minute flight. I remember I couldn't be on the helicopter with them, so I had to leave her in the care of the flight team. And I remember my husband and I riding in the car with my mom and my sister, and every time his phone rang, my heart just stopped because I was waiting for them to tell me that she had not made it. We got to Children's Hospital, and it was probably about 3 hours later that I finally was able to see her. The doctors came in and spoke with us because as soon as she got there, she was put on life support, dialysis, and of course intubated, because on the flight, she actually had to be handbagged the whole time. The doctor came in and he basically had told my husband, because I was in the room with her, at that time they had told my husband that it was more than likely she was going to pass than live. And again, I mean, at this time, we still only knew she had pneumonia. It was probably about 12 hours later that we finally got her diagnosis, and it was influenza B, pneumonia, and MRSA. So she was becoming very septic. She ended up being on ECMO for a full 2 weeks, had a lot of complications in that 2 weeks. She ended up having a hematoma form, and it was basically pushing her diaphragm all the way over to the left side. So while she was on life support, they ended up having to put chest tubes in to remove that blood from the buildup and everything. After she was taken off ECMO, after 2 full weeks, she still was in a medicated induced coma. She was on dialysis and intubated for an additional 3 weeks, so altogether 5 weeks. And that was probably the hardest, I mean, definitely the hardest time of our lives and everything. We still didn't understand how she could become so sick, from the flu. And I mean, I always got Madison vaccinated for all her vaccinations, and including the flu. However, that year, it was not available when we went to do her sports physical, and I put it on my to-do list. However, I just never made it a priority. After she finally came off of life support, dialysis, and intubation, she spent another 3 weeks in the PICU. Then she had to go to the rehab floor. She had to learn completely how to walk, how to write her name, how to throw a basketball. And that child's been throwing a basketball since she was 3 years old, but she had to learn all over again how to do that, how to kick a soccer ball. So after 93 days at Children's Hospital, she was able to walk out of the hospital with us. Madison now is 22 years old. She just graduated from college. She received a scholarship for soccer, and she was their starting goalie for the last 4 years. To look at her, if you look down, looking at the screen, it's the right-hand corner where it's a picture of myself, my husband, and her. To look at her, she looks completely healthy. You would never know that something had ever went wrong. She had an illness. However, Madison suffers lung disease. She has severe asthma. She has a chronic cough that she'll live with for the rest of her life. She's prone to pneumonia. At this point in her time, they finally have gotten her on the right medications and everything, and we've not seen so many cases of pneumonia. So the hope is that she won't have to have, part of her lung removed. However, that is definitely a possibility. They said as she gets older, that would probably, the possibility will become more. Forever, she will be ill, and prone to illnesses. This year with the COVID, that was a huge scare for us, just not knowing how to, resume with life. We kept her pretty sheltered. She came home from school and lived in a bubble for about 8 weeks. She finally has, like I said, she just got out of college and she's now working. But every year is it's tough around flu season. Even though our story started 10 years ago, it still feels like it was yesterday. And again, I say that I believed in vaccinations. I believed in the flu shot. I believed in them because our pediatrician, told us it was best for us. The problem is I didn't know the importance of it. And I think that's where parents and just people in general, are confused by it. They understand that, yes, it's recommended and everything, but they really truly need to know the importance of prevention and protection. And so with that, that is Maddie's story. It was 93 days of pure ups and down. I always tell people that it was a roller coaster, and anybody that knows Maddie or I, neither one of us like heights or roller coasters. So it was not a fun ride. However, I am happy to say that, we were able to walk out of the hospital with our child. A lot of family members that are part of our organization aren't able to say that. So that is why we advocate and try to educate so that nobody else has stories like ours. So if we want to go ahead and we can move to the next slide, Brian. Thank you. So Families Fighting Flu is more than just our name. It's actually who we are and what we do. As Brianne told you, about our organization, we were founded in 2004. We're a national non-for-profit organization dedicated to protecting children's families and communities against the flu. When we started in 2004, our main focus was children. And as we've grown, we've discovered that, it's not just children that we need to be protecting. We need to be protecting and advocating for all people of all ages. It's about families and it's about communities. I don't know if you guys know, but I'm actually in central Illinois. So I'm, we're all over the United States. So it's not just one state that is advocating. So we are family members, we're board of directors, we have medical advisors, we have staff and volunteers. I will say right now, our board of directors is compiled of family members. Our organization in 2004, when it was started, it was started by 3 sets of families that had lost their children. And what they found was that there was no organization out there to help with, there was lots of things out there, but there was no organization out there that had the stories, I should say. And I will say how I came about Families Fighting Flu was, it wasn't until about 2 years after Madison had came home, and locally there was nothing for us. Yes, we went to our doctors. Yes, we saw a therapist because it was a traumatic situation for both her, myself, and my husband. However, as a mom, I felt a lot of guilt, and there was nobody that understood. People would, oh, I understand, but they truly didn't understand the guilt that I felt, and they didn't, and there wasn't anything local for us to be part of or to understand more. And so luckily I was on social media, and I was on Facebook, and I was reading this story, and it was Austin Booth, and he had lost his life to flu. And as I was reading the story, I just was crying. Tears just kept coming down, because I was like, this is my daughter's story, but it's another mother writing this story. And so at that point, I went on to Families Fighting Flu website, and I found that there was others just like us. And that's how I became part of Families Fighting Flu. I wanted to take the guilt that I felt and make a difference. And I think that's really what, Families Fighting Flu is about, is, making a difference and letting other family members know that they're not the only ones out there. So our organization was started by 3 families that had lost their children to the flu. Next slide, please. So some flu facts. Obviously, you guys probably have seen all these, but we like to remind people that in 2019, 2020 season resulted in upwards of 62,000 deaths in the US, including 188 children. On a global scale, the flu kills 650,000 people every year. Majority of the people who are hospitalized or die from the flu are not vaccinated, and that was the case for Maddie. Annual flu and vaccination is important for the protection of public health, not just individual health. I stress that a lot, that sometimes it's not all about you. And I know that sounds harsh, but my father was one that did not believe in the flu shot. And I remember, afterwards, going through what we went through, obviously his mind and his way of thinking changed. But I remember saying to him, it's not about you. It's about others. I mean, it's always about you, but it's not always. It's about others that can't protect themselves. It's about your granddaughter who has a compromised immune system, who needs all the protection she can get. And that means you protecting yourself so you can protect her also. So I do stress that quite often, especially in our community. I say that, and sometimes, a lot of times I will say it hits home for them. They're like, oh, I didn't get it that way. I just was like, I don't believe in it because of all the myths and stuff. So, so that was, a good key point that I try to stress. CDC recommends flu vaccination for everyone 6 months and older. I will say Families Fighting Flu, that is where our reliable source is from the CDC. Next. As you can see, flu vaccination rates, on an average, 62.6% is pretty good. I mean, it's not bad, but that's an average. And if you sort of see the line below, that is ages 13 to 17 years. And there needs to be a huge increase in that. I mean, I wouldn't say 62.6 is great, but it's better than what it's been in years past. We would love to see, everybody vaccinated, but there are a lot of people out there that still believes in the myths, and those are just things that we try to continue to change. Next slide. As you can see, adults, the average is 45.3%. I think vaccine confidence is still an issue, especially for the flu. According to a recent survey we did, which Families Fighting Flu did in May of 2020, vaccine myths and skepticism still persists. So again, it's the younger generation that, our percentage is down. It's those college students, young parents, it's only at 34.9%. So obviously there's still more work to do. And as Nevada actually is the lowest ranking state for flu vaccination rates. That's, heartbreaking. Illinois is right there with you guys. What I keep saying is that we can just continue to educate and advocate and continue to do better. As I said, in May of 2020, Families Fighting Flu actually did a national survey. These are our results. Again, as you can read through this, a lot of it was still the younger generation not being vaccinated. I will say after the survey conclusion, there was a 10-point increase in those saying that they would get flu vaccine, which indicates that they are open to learning and changing behavior. So the target audience is younger adults, those without a college degree, moms, Hispanics, African Americans. We still, step one is to educate target audience on the safety and effectiveness of the flu vaccine, address the flu-related myths. And then step two is communicate vaccination benefits such as symptom severity and severe flu-related outcomes. Next. A patient's perspective. So why should I care about the flu? What are the real risks to me and my family? And how can I protect myself and my family? What we come up with is, first of all, the flu is the deadliest vaccine preventable disease in the US. Everyone is at risk from flu, regardless of age, gender, health status, or lifestyle. The flu does not discriminate. It does not care what age, color, male, female, anything. I mean, again, I go back to my daughter who was 12 years old. She had just finished soccer season or basketball season and soccer season, and she was healthy. And I thought it was just the flu. So again, it does not discriminate. And then annual flu vaccination, practice healthy habits such as wash hands, wear masks, and seek medical treatment if you fall ill. So take antivirals. Next. Sorry. How does family fighting flu? How does family fighting flu reach people? Well, we reach people where they are at local, regional, state, and national levels. We communicate with people on channels where they are getting their health information. We do a lot of social media, digital media, earned media. We believe in education leads into empowerment. Informed people will make good decisions. Next. Again, social media as a critical channel. 69% of people use an average of 3 platforms. 75% of parents get advice. 60% of people get health information. The one thing I always still say is still remember Google is not a doctor. Make sure it's a reliable source. I think, the younger generation or just everybody nowadays, we tend to jump on the internet and look up our symptoms and say, oh, well, we just have this and this is what we can do for it. Well, that's fine for most cases, but in other cases, that is not. Had I just got on Google and looked up Madison's symptoms, I might have not taken her to the doctors. I would have said, again, I was saying it's just the flu. But luckily, I had not gotten on the internet and started looking up her symptoms because maybe I would have hesitated to take her. And had I hesitated, our outcome could have been, that she would have died. So again, I tell people, please make sure you reach out to your healthcare providers. Trust your healthcare providers because they do know what they're, talking about, and they are the experts. So next, the power. I think that's what sets us aside, or that's what makes us different. Families Fighting Flu has the power of emotional storytelling. I don't know if there's any other organization out there that is similar to us, but that's what we bring to the table, is that we have the stories and the faces to put with the flu. And we share our stories because we want others to know what we didn't, and we want to prevent others from having a similar experience. People can relate to stories, and it can change their intention to vaccinate. And that's why I tell Maddie's story, is just hopefully somebody will maybe change their mind, or they'll contact their healthcare provider and ask more questions. So that, again, is why we tell our stories. Stories are 22 times more memorable than the data. There's nothing, Alyssa Kanowitz, she actually is one of the founding families that started this organization. And, what she says is that there's nothing more that they could have done for their daughter, or they could do for their daughter, but they feel it's their responsibility to raise awareness about the risks of flu. Amanda was, 4 years old and passed from the flu. So we are very fortunate that, that they started this organization for myself and others like me. So next. So I think this is a pretty powerful picture right here. We put a face on the flu. And sometimes, when we talk about illnesses or diseases and stuff, you don't really put a face to it until it hits, right at your home or something. I will tell you, like, this, just pulls at the heartstrings, because first of all, I've read each and every one of these stories. I will tell you, Austin Booth, who is the story I read, he's the boy up top that's holding the fish. And, I've read each and every one of these stories, and this is why I come and present and advocate, not just for my daughter, Maddie, but for each and every one of these people, the children, the moms, the grandmothers, the grandfathers. I advocate for each and every one of these faces and many more. So our mission, as Brian said, is to save lives and reduce hospitalizations. And these are just some of the stories that illustrate that flu does not discriminate. So the role of healthcare professionals. First, like I said, always, the healthcare professionals are a trusted resource to educate and inform patients, protect public health, and set the example. It's a recommendation for flu vaccination from a healthcare professional is critically important for improving vaccination rates. Again, I will tell you that I believed in the flu shot. I believed in vaccinations. I did because our health care provider told us it was the best for her. Again, I think we just need to make sure we explain the importance of it. And that's the biggest thing. So many of us get in such a busy time of our lives that, yes, we've got it on our to-do list, but we just don't make it a priority. So that would be the best advice I could give, healthcare professionals. Not that I'm, a healthcare professional, but as a parent, is get parents to understand the importance. And I think that will make a difference. Next. We actually, at Families Fighting Flu, we have a lot of resources, and a lot of our resources are free. So, we have them available in English and Spanish. We have, different sources that you can print off or you can actually contact Cerise Murata, who is who is our COO, and she can mail those out. She actually has staff that will mail that information out. We have healthcare toolkits, and you can use them right there in your offices, or if you want to take them or somewhere, but those are provided free also. So we do have those on our website. Please feel free to, utilize those. Next. Again, these are just some of our resources that we have. I think you always have to find resources that sort of like will hit home for them. I think the one in the corner, do you know the flu? That one is a really good one with children and in schools and stuff. So we do try to update, we obviously update all of our information according to with the CDC, but we do try to revamp our resources so that they're always fresh and catching the eye. So again, you can go to familiesfightingflu.org to order any of these resources. Next. So today, here's what I'm asking. I'm asking for healthcare providers, make every appointment a vaccine visit, and keep recommending the flu vaccination throughout the season into December and even later. I will tell you, Maddie got sick in February. Had I slowed down and maybe got her vaccinated in January, would we have had the same outcome? Probably not. I want to believe that we would not have. So, we continue to tell people that it's never too late to get your flu vaccination. We're asking that you work with your community partners, schools, employers, community centers to hold on-site or mobile flu vaccination clinics. Here in my community, we actually have, it's called the Flu Bowl. We have a rec center that is called the Bowl, and that's actually where our health department does their flu vaccination clinic. So come up with a catchy title for people. And a lot of our community members, they love to, especially our older ones, they love to go to the Bowl because it's such a historical place for Jacksonville. So that's where they get their vaccination. Make the promise to get vaccinated through our flu vaccination promise program. If you actually go onto Families Fighting Flu, we actually have it's the flu wall, and you can sign, and it's the promise that you're going to get vaccinated. You can have your family members do that also. You could do it in honor of somebody that that has suffered from the flu, or just sign the wall. We also have a texting program. So if you sign up or text Fight Flu to 47177, you will get reminders ever so often about getting your flu vaccination. I will say I did that, and it's actually sort of nice to get that reminder every once in a while. Also, just share our educational resources with your patients, families, and friends. You also can share your flu shot selfie with us. We have been doing that on a lot of our social media, is that when somebody gets their flu shot, just take a selfie or a picture of your Band-Aid and send it to us. And we've been getting really great turnout for that, and a lot of positive feedback from that. So, and then the last thing is definitely please just share our stories. Feel free to share Maddie's story, or go on to our website and read all the other stories. please direct parents or, people that, are unsure of the vaccinations, to our website, and hopefully, by them reading, they will, have a change of heart. So, next page. And so this contact information is actually for Cerise Murata. She is actually our Chief Operating Officer. She's the one that runs our organization. Something about Cerise is that she not only runs our organization, she was a board member, but she and her husband lost their 5-year-old son, Joseph Murata, to the flu. So again, not only am I and other parents, this is dear to our heart, but also Cerise and her husband. But you can reach out to her for any additional information, and she can get in touch with me. You can check us out on our website, and then obviously we've listed our social media sites also. So.
Thank you so much, Shelley. Before we say goodbye, I do see we have a couple of questions posted in our Q&A box, but if you have any other questions for Shelley, please make sure to type them now. We're offering a little more time for those. If while we're waiting for those questions to be typed in, just a couple of reminders. If you've requested continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended, or in tomorrow's post-event follow-up email. All CEs will be emailed out within the next week. And then if you'd like to view or share this webinar, the recording will be available on the Immunize Nevada website, along with information for future webinars. Please visit immunizenevada.org/webinars for those details. So let's go ahead and take a look at the Q&A box now. The first question that we have, Shelley, is how is Families Fighting Flu working to reach out to specifically the Hispanic and African American communities? We know that they're so disproportionately affected by COVID-19 and flu included. So what are you doing for those folks?
So honestly, I mean, I think we're doing it as just in general is, definitely reaching out on a lot of our social media platforms. I would have to get back with Cerise on all the details because she's the one that runs the organization and does all those things. But, definitely, the social media resources, we make sure our resources are for all communities versus just, one specific. So.
Sure. No, and that's what I was going to say too. I noticed with a lot of your flu vaccine promotional materials, they include, photos of diverse audiences as well. So making sure to emphasize that the flu impacts everyone and does not discriminate based on your race and ethnicity, which I think is super important. We've been trying to be very mindful of that as well with our marketing materials. And then the next question that came in, what have you found to be the most effective strategy for encouraging someone to get the flu vaccine when they're on the fence about it?
So, when I talk with somebody or talk with a group, first of all, I am very respectful. I try to listen and really just telling Maddie's story or other stories. I mean, I can't talk for I talk for the other, children or, families and stuff, but I really just try to be really mindful and listen and understand where they're coming from versus just saying, well, I'm going to stand out in the hallway and I'm going to give you your flu vaccine. I just try to, again, I'm not a professional healthcare provider. So, I'm not a scientist. I work accounting in a road construction office. So what I tell people is that I'm not a professional. I can tell you what happened to my daughter. And so I just really just tried to, reiterate that I don't want to scare you into getting, the flu vaccine, because not every time somebody doesn't get the vaccine that, if they get the flu, it's going to be as bad as what Maddie had. But I just will tell people that had she had the flu vaccine, this definitely could have been a lot less. Her complications, hospitalization could have been less. So, we don't know 100%, but I also tell people too about vaccines is that no vaccine is 100%, but I will take 1% chance of protection than none. And I also say, you sort of look at seatbelts. You can't guarantee me that seatbelt is going to save my life if I'm in a car accident, but it's the best prevention I've got. So I'm going to do it. And I sort of look at vaccines sort of like that also.
No, I think that that's really effective. And that's why we had you and Families Fighting Flu today to wrap up this week of flu focused webinars for Immunize Nevada, was that I think it's important to realize that behind everything that we do as public health and healthcare professionals, there's real people who are impacted by what we do or don't do, and that our words matter, and that the information and communication that we receive from trusted healthcare professionals impacts moms like you. So I so appreciate you coming and sharing Maddie's story and your family's story today with us, and hope that we can prevent this from happening to any other family moving forward.
Thank you.
Of course. We'll go ahead and with that conclude today's NILE webinar. Thank you again, Shelley, for coming and presenting for us today, and for those of you who participated. We hope you have a great day. And again, we welcome any and all feedback, whether or not you are seeking continuing education credits for today. So please complete the survey that will pop up shortly, or in the email tomorrow. Thank you so much.
Thank you.